Dear colleagues, December is a month of both celebration and reflection, and as a University Health Board it gives us the opportunity to reflect on everything we have achieved together over the past 12 months. This year we celebrated the NHS at 70. The NHS is the envy of the modern world and was created here in Wales, and this year we took the opportunity to celebrate our much loved national institution and brought the work we do into the public's hearts and minds, from tea parties to art events, including our first ever bed push with our health charity, raising money for our patients and staff. The clinical innovation and advancement of treatment and drugs over the 70 years has been phenomenal, and just this year we've been part of a groundbreaking clinical trial to prevent and manage the chronic autoimmune disease type 1 diabetes, giving the first 2 patients in the world with the new investigational drug which aims to reduce dependence on insulin for those with the disease. We've launched our dementia strategy, social prescribing, and won awards for the work we have done on stroke, dementia and in obstetrics, reducing harm from postpartum hemorrhage. All of this affects our communities and their families from birth to death and has significant impact on improving people's lives. This year has been an exciting year for us. We have been designated as the major trauma centre for Wales. We've had 30 million approved to develop the new spinal and neuro centre at Llandoch, replacing our much loved Rookwood Hospital, which celebrated its 100th year anniversary in line with the end of the First World War. As a health board, we're very proud of the work that we do with our veterans and have been awarded a Gold Award for the work that we do with our armed forces and veterans from across all conflicts. We refreshed our transformational and improvement programme, focusing on delivering our strategy, shaping our future well-being, by forging a working alliance with Canterbury, New Zealand and other global partners to ensure that Cardiff and the Vale remains as the vanguard of transformational healthcare services. The Transformation and Improvement Programme aims to ensure that patients and their health remains at the heart of what we do. Each and every one of our staff, from the GP surgery, receptionists, porters to nurses, therapists, surgeons and hundreds of volunteers, the list is endless. You make a huge contribution to delivering a quality service and safe patient care 365 days a year, and for this we, the board, thank you wholeheartedly.
We believe that we have some of the most highly skilled and dedicated people who work for us all year round, and you only have to look at the list of awards and achievements over the last year, never mind the last 70 years. But also how as an organisation we responded to the challenges of the snow last February, an outstanding response of goodwill, dedication and care from everyone ensured that we were able to keep our services open and up and running as far as possible. This year has been an outstanding year for recognition, and we are both looking forward to one of the most humbling and inspiring nights in our Health Board calendar in March, our Staff Recognition Awards. It's important that we celebrate success at every level, but also that we recognise the day-to-day achievements of all our staff that very often goes unnoticed. Very often you go above and beyond, such as the staff on our critical care unit who helped a patient marry his long-term partner earlier this year, and the compassionate innovation in caring for people with dementia on the Sam Davis ward in Barry Hospital. Next year already promises to be an interesting year. We will be working with our partners to ensure that our staff affected by announcements on Brexit will be able to remain working in the NHS and with us, and that the highly skilled, diverse and committed workforce continues to offer their skills to our equally diverse population across Cardiff and the Vale. We're also the first health board to have been awarded money under the Welsh Government Transformation Fund, and we'll be working with our partners in the Regional Partnership Board to focus on prevention, intervention and keeping people well in their communities. We will also be developing our clinical services plan and models of care, involving moving some non-clinical functions off the site at UHB and looking to replace the old hospital with a new fit-for-purpose and modern healthcare hospital, which is aligned to our community health and social care needs. There are so many great things that we could share with you, and there are far too many to mention in this message. But we will be producing a look back on our year of NHS at 70. And we would encourage you all to take a look and remind yourself of the great work that you do all year round. As we approach the Christmas holiday season, some of us will be looking forward to taking time off, but many will remain in work, providing a range of clinical and non-clinical services to keep our hospitals, GP surgeries, buildings and range of health services open. From our waste disposal teams to ward caterers to community healthcare staff, doctors and nurses and more. It's all of you that keep services running to care for our patients. Winter is a challenging time of year for the health service, and especially so combined with the holiday season. So we thank all of those staff who are going to give up time spent with family and friends to keep us open and operational during this period. 2019 and the new year will also bring a number of new challenges, but we are sure your efforts will help us to continue to deliver and achieve great things for our patients and our communities across Cardiff and the Vale and across Wales over the next 12 months with optimism and commitment. On behalf of the board, we would like to wish you and your families a happy Christmas and a peaceful and healthy New Year. Diolch.
Ho, 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 ho! Merry Christmas!